What does nighttime snoring suggest and how do we manage this? Nighttime snoring can be very common in younger children, particularly if they have a viral illness, because at that time they can have enlarged adenoids, which is behind your nose, or enlarged tonsils, which is inside your throat, and that leads to obstruction or narrowing of your breathing tube, and when air is passing through a narrow tube, you have snoring. But if snoring is there every time, every night, even when they do not have viruses, that can be a symptom of obstructive sleep apnea. This needs to be addressed by a pediatric pulmonologist or team who are managing sleep-related disorders. Your child needs further investigations that could be in form of a neck x-ray looking at the size of adenoids, but the gold standard test for this is doing an overnight polysomnography, which is called a sleep study. They might have sleep apnea, and in younger children they might need some nasal steroids or removal of their adenoids and tonsils. In older children, or if they are obese, they might need nighttime machine to breathe, which we call as CPAP machine.